Hello, I'm Dr. Sanjay Panicker. I founded Amrita Homeopathy. We are placed at two locations in Bangalore, one at Koramangala, the other at Marathalli. The most common symptom of acidity is a discomfort or a burning sensation in the upper part of the abdomen or upper part of the chest or the entire chest. This burning sensation, or sometimes it could be a catching sensation or a gripping sensation or a pain around the epigastrium, that's the upper part of the chest just below the sternum, or in the chest area, the burning sensation of pain could be an indication of acidity. Some patients do complain of shifting pain in the chest or in the abdomen, like the pain is in one area sometime and next time it is in the other area. It keeps moving from place to place. Sometimes there can be a referred pain to the shoulder or to the neck, upper part of the back, in the region of the scapula, in the lower end of the scapula, on the margins of the scapula. All these areas are commonly prone to develop pain when gastritis or acidity is present in the patient. Some patients do feel a lump like sensation in the throat. Some patients feel a bitter taste in the mouth, and sometimes it could be severe, leading to even nausea and regurgitation of the food, as it is common in gastroesophageal reflex disease. Now, in this condition, how do you manage? First thing, this happens because you're not sleeping on time, you're not eating food on time, you're not eating the right kind of food, you're not exercising adequately, not drinking water adequately. These are the main five reasons why it can happen. And the sixth, the king of all reasons, is stress. The more stressed you are, the more you are prone for acidity. So if your stress levels are on the lower side, you can solve one fourth or half of the problem. If you're eating food on time at regular intervals, they say 6 small meals instead of 3 large meals is the best solution for acidity. Eating simple, bland food or food which is not too spicy and not too fatty and oily will help to have a regular food in the digestive tract in the stomach, so that the acid which is produced by the stomach has something to digest. If that is not there, it will corrode your own lining of the stomach. It may also leak into the upper part of the food pipe, the lower part of the food pipe, that is esophagus, and cause esophagitis. I have many cases where the patient has even developed esophageal ulcers, esophageal erosions, and even sometimes bleeding and vomiting of blood because of the erosion which happened in the lower end of the esophagus. This is commonly seen in people who smoke and drink a lot. So, smoking and drinking can increase the acid secretions. Eating too much spicy food and not the right kind of food, that is, junk food, can again lead to acidity and acid secretions increase. If you sleep early and wake up early, that is again going to help to improve your digestive process. Exercising 15 to 20 minutes daily will improve your digestion for sure. At least 3 liters of water a day is good for your health, and it will see that the acid is diluted and also the acidity comes down. Avoid tea, coffee if you have excess acidity. This will also help you. These are some of the common do's and don'ts which you need to do so that your acid secretions can reduce. A more fruit rich diet will actually help you to reduce acidity, but not the acidic fruits like citrus fruits, pineapple, pomegranate. These are acidic fruits. You have more bland fruits like banana will reduce your acidity to an extent. Watermelon will help you to reduce acidity. Papaya will help you to reduce. These kind of foods will help you overall. Homeopathic medicines used in acidity are most commonly natrum phos and rubenium. The other remedies like arsenicum album, nux vomica, lycopodium, carboveg are also used in the treatment of acidity based on symptoms. And this is best decided by a homeopathic doctor. It's of late it's becoming common practice to see videos and then try to self-medicate yourself. Please don't get into that. If you have any symptoms which indicate acidity, it is better to contact a nearest homeopathic doctor and inform your symptoms, because symptoms is what helps in prescribing homeopathic medicine. It is not just acidity, it can be acidity with burping, it can be acidity with bloating, it can be acidity with flatulence, it can be acidity with nausea. Based on that combination of symptoms that the patient has, the remedies vary. Looking at the tongue, the physician can tell a lot about what medicine to prescribe. Abdominal examination can give us an idea about what medicine to prescribe. So this all is important, which you may not be able to do it yourself. It's better to contact a physician, especially in cases where there is erosions and ulcers. To avoid complication, it is best to meet a homeopathic doctor.